It's 27 News First Mid-Morning. We welcome you back. A bill that would ban smoking in public places across Kentucky is right now up for consideration. Tomorrow, members of the Kentucky chapter of the American Heart Association are inviting folks to join them in Frankfort for a rally in support of a smoke-free Kentucky.
On Valentine's Day, Dr. Sylvia Sorrell-Sewell is on the board of directors. She's president for the AHA, and she joins us this mid-morning. Thank you very much for coming in.
Well, thanks so much for having me.
And obviously you believe this is a really important thing to do.
Well, there's a lot of nice things. We're going to Frankfort tomorrow, obviously, to help our legislators know how to help Kentuckians with their health. All of February is Heart Month, so we're all wearing red tomorrow to show our legislatures the #1 cause of death for all of our men and women in Kentucky is heart disease. And this particular bill, which was sponsored by Susan Westrom and by I'm going to say her name wrong, so I'm not going to say it, but by one of her colleagues from Louisville, is put out because passive smoking or, secondhand smoke that non-smokers are exposed to in public places increases your risk of heart disease by 30%. So we're not telling people they can't smoke. People are perfectly willing, permitted to smoke in their own private places, their homes or their cars. But we're saying people have the right to breathe clean air when they're in a public place, their place of worship or work or a restaurant.
Well, Doctor, as we know, most of Kentucky's surrounding states have done this. Ohio did it by having a public vote, and the voters there decided to do it. In Tennessee, it's restaurants, I think, and most of the other states do have this in place. And yet there is this feeling by many that if you own your own business, you should be able to set the rules. If people don't want to go there, then go elsewhere.
Well, fortunately, the Chamber is one of the many of the coalition that's behind this, because now we've realized that this is good for business as well as good for our health. So business owners are realizing that the cost of health care for their employees, as well as the demand from customers, is good for this. So we have the many health organizations, including the AMA, the Lung Cancer, the Lung Association, the Heart Association. Tomorrow we'll be having the American Cardiology Association's chapter coming out lobbying with us. So there are a lot of groups in support of this, which is why we think that we can get it passed. But the businesses have a lot to gain as well, because their employees who are exposed have illnesses, not just heart disease, which kills more people than all the cancers combined, but also the illnesses which make their employees out sick, asthma, respiratory illnesses, etc. They gain as well.
So how do you need other people to get involved?
What a great question. Thank you so much. What people in the audience can do is call their legislature. They can write, they can call, they can get involved. We have 80 volunteers who will be with us tomorrow. Anyone else is certainly welcome to come out tomorrow and join us in Frankfort. This is an important cause. If you don't want your child to be ill, we have 34 communities in Kentucky who have already passed this. When my husband and I moved back home to Lexington 21 years ago, we wanted this to happen, but we really felt there was no hope. Going out to smoky restaurants, it made me ill, Now we take it for granted. You go into some of our rural communities and it makes some of us sick. It makes children get asthma. So we want to help the children who become sick, the patients with emphysema who become sick. So anyone who wants to become involved can come join us in Frankfort, get there at 8:30 in the morning. Please write your legislator. Please pick up the phone and call Frankfort, or certainly call your Heart Association office and tell us you want to help.
Governor Beshear has indicated he will sign it if it gets to his desk, although he has some questions as to whether it will make it through the legislature. So
well, I think we think it can in the long run.
Thank you for coming.
See what happens.
Thank you so much.
Appreciate it very
Thank you.